Hi everyone, my name is Brooke Stearns, and today I'm responding to the prompts on gun violence, healthcare, and safe consumption sites. First off, for the gun violence. On gun violence, a lot of people argue that the solution is more security at schools, metal detectors, armed guards, or even arming teachers, but those ideas don't get into the real issue, which is access. Most school shooters don't find guns illegally. They get them from their own homes or a family member. This means that the real problem happens before they ever reach a school building. Adding more weapons inside schools doesn't fix that. And research even shows that schools with armed officers often have higher fatality rates during shootings. So instead of turning classrooms into prisons or military zones, the most effective solution is a national licensing system, like how we regulate driving. That means training, registration, background checks, and secure storage laws that actually prevent kids or unstable adults from accessing firearms in the first place. Schools should rely on controlled entry points and trained threat assessment teams, not more guns. The goal is prevention, not escalation. For healthcare, the U.S. system is failing because basic healthcare is way too expensive. Millions of people skip doctor visits or medications simply because they can't afford them. We also spend more per person on healthcare than any other wealthy country. Yet our outcomes like life expectancy and chronic disease rates are worse. A lot of people say that the answer is fully universal government-run systems, but countries with those systems also struggle with long specialist wait times and access issues. Instead, a better model is a regulated multi-payer system like the one in the Netherlands or Switzerland. These countries guarantee essential health care for everybody. But private insurers still exist. They just have to follow strict rules on pricing and coverage. Patients get access, affordability, and choice. This approach would reduce racial and economic disparities in the U.S. without forcing one single federal plan to control every medical decision for 330 million people. Universal access doesn't require universal ownership of the entire system. Lastly, for safe consumption sites, the U.S. loses more than 100,000 people a year to drug overdoses, and most deaths happen when people use alone. Supervised consumption sites do reduce overdoses and disease transmission, but the positive results we hear about mostly come from large cities with strong treatment systems. Smaller cities with fewer treatment beds or weaker public health infrastructure may not see the same outcome. These sites also don't involve the deeper cause of addiction like homelessness, unemployment, and trauma, and they require continuous public funding for staff and security. Many communities worry that they would become magnets for open drug activity, even if crime rates don't technically increase. A stronger policy is to treat safe consumption sites as tightly monitored pilot programs, not the main strategy. They should be paired with on-demand rehab, medical-assisted treatment, and housing-first programs with a clear pathway to recovery. The goal should not be to normalize drug use. It is to keep people alive long enough so to actually exit addiction. And to sum it up, reducing gun violence requires fixing access, not adding guns to schools. Improving healthcare means guaranteeing basic care through a regulated system, not relying on a single federal plan. And addressing overdose deaths require harm reduction tied directly to real treatment and housing support. Thank you for listening. Goodbye.